One of the unique features of the Laser and Skin Surgery Center is that all of the doctors here are concentrated on these very specific technologies that are very new and very cutting edge. We enjoy working with them, and because we focus all of our time on it, we feel that we really are experts in this arena. This means that we are specialists in laser technologies, filler technologies, body sculpting, and Mohs micrographic surgery for skin cancer. At the Laser and Skin Surgery Center of New York, we have all of these technologies that we feel we really have an advantage, that we don't have to do a one-size-fits-all strategy for our patients. We can pick and choose among all of the technologies to really give the ideal approach for our patients. So today, we're going to be looking at the Ulthera treatment. Ulthera is part of this holy grail, this pursuit that we have of being able to tighten skin without having a patient undergo surgery and downtime. So the Ulthera harnesses ultrasound technology to create the effect. The idea is that we can create small points of heat under the skin surface. These little points of heat create microscopic wounds. We call them thermal coagulation points. These little points of heat will allow restructuring of collagen and stimulation of new collagen growth. And this, over time, will create a mild tightening effect. I help patients understand that there's a variety of technologies out there, and they do very specific things. So very often when a patient comes in for an Ulthera treatment, there usually has been a consultation already where a patient has come in with very specific concerns. Those concerns tend to be looseness or sagging in facial skin, as well as skin in the neck area. The treatment is comfortable. The patient lies on a table. The patient is fully awake and able to interact with us during the procedure. We remove the numbing creams, and we look at the areas on the skin that we're going to be targeting. We have the Ulthera device in the room with us, and there's a handpiece that comes from the device that we will be applying to areas of the skin for the treatment. We pass the handpiece of the Ulthera along the treatment area one step at a time. If patients need a break during the procedure, it's not difficult to do that. So people always ask when they're going to see the results. Some people see an initial contraction right on the day of the treatment. But I expect the maximal contraction to come about at about 3 or 4 months after the procedure. The patient can look in the mirror and they'll be surprised that their skin doesn't look very different from when they walked in. It's a nice thing to see because there's so many treatments out there where people look bright red, flaky, swollen. This is not that sort of procedure. The patient may look a little bit pink in the areas where they had the treatment, but that's it. Patients can easily put on makeup or sunscreen to try to mask some of the pinkness that they have and resume their day. And that's why a lot of people refer to the Ulthera as a no downtime procedure.